This is RTV6 News at 7, working for you.
And good evening to you at 7 o'clock. I'm Mark Mullen, social distancing in my temporary home studio.
And I'm Amanda Starantino at the RTV6 studios. We begin with the latest developments in the COVID-19 pandemic and its impact on central Indiana. Indianapolis Mayor Joe Hogsett today announced the stay-at-home order in Marion County is being extended to May 15th. The order will continue current restrictions on all non-essential businesses. Restaurants will be allowed to continue offering carry-out or delivery services, and grocery stores, pharmacies, and other essential businesses will remain open. The order also requires all Marion County residents to wear a face mask when out in public. Tomorrow, Governor Holcomb will outline his plan for moving forward. Indiana's stay-at-home order set to expire late Friday night.
To be among heroes in the Hoosier State who are saving lives all across America. We are so proud of each and every one of you. We truly are.
Vice President Mike Pence was back in the Hoosier State today, thanking workers at General Motors, the plant in Kokomo there. They've taken a detour from making auto parts and are now producing ventilators that will be distributed to hospitals across the country. They've made more than 600 in less than a month. The goal is to make a total of 30,000 ventilators by the end of August. Today we learned Indiana's death toll from COVID-19 has now surpassed 1,000. The number of confirmed cases in our state, nearly 18,000, and more than 94,000 Hoosiers have been tested, with nearly 19% of that testing positive.
Experts are warning about another potential health crisis as parents cancel regular doctor visits for their kids to avoid coronavirus. Immunizations are dropping at a dangerous rate, putting millions of children at risk for measles, whooping cough, and other life-threatening illnesses. RTV6's Cornelia Socker shares how doctors' offices are trying to ease parents' fears.
When I went the last time, it was like me and one other person. They're not seeing anybody unless it's like you're at the end of your pregnancy.
Like most parents during this pandemic, Bailey Bennett is taking all the necessary precautions to keep her family safe. She told me about one of her recent trips to see her doctor.
It was eerie. You know, I went to our hospital and I got screened because my doctor's in the hospital. So they have all the doors shut down but like one, and you get screened and they take your temperature and ask why you're there because nobody can have visitors.
Although those things may seem a little bit scary, Bailey is hoping parents realize those precautions are in place to protect your kids so you don't have to skip out on those wellness checkups. Comparing the week of February 16th as a pre-coronavirus baseline to that of April 5th, PCC, a pediatric electronic health records company, compiled vaccine information from 1,000 independent pediatricians nationwide. They found a significant drop of 50% for measles, mumps, and rubella shots. Diphtheria and whooping cough were down by 42%, and HPV vaccines were down the most, 73%.
I would say that the majority of parents, believe in vaccines and they want to stay up to date with vaccination.
Dr. John Christensen says parents should know many pediatric offices have switched up how they do things to keep kids safe.
Some of the practices have built in ways of either bringing those children early in the morning, schedule appointments so there's none of them in the same waiting room at the same time.
Knowing that doctors' offices are doing everything they can to keep their patients safe brings Bailey some comfort as she prepares to bring a baby boy into this world at the end of May.
I'm no medical expert by any means, but I try to trust people who are more knowledgeable than me. I trust the CDC for vaccinations for my daughter.
Working for you, Cornelius Hawker, RTV6.
Indiana state leaders are working to make sure you and your family have access to everything you might need during this time, and that includes financial assistance and mental health resources. Our Alyssa Donovan explains as part of our Rebound Indiana initiative.
Mental health issues and substance abuse disorders can be triggered by isolation, according to mental health professionals. So when Indiana Family and Social Services staff started noticing an increase in calls for help, they decided to take action. The data doesn't lie. Since the stay-at-home order went into place in Indiana, calls to 911 for certain issues and crisis hotlines have been on the rise. Suicide calls between March 13th and April 13th, up 138% in Marion County. Domestic 911 calls during that time, up 46%. In St. Joseph County, mental problem investigation calls up 50%.
As we started to see these trends emerging, we knew that we had to put something together that was easily accessible to start providing a foundation of increased support for our state and our communities.
Which is why Indiana Family and Social Services has rolled out this website, BeWellIndiana.com. To make it easier to find tools to help you through the pandemic, you can find resources for mental health issues, substance abuse issues, and financial assistance. There are also videos with tips on how to deal with this crisis, how to discuss it with your children, and how to deal with the mental stress.
It's important for people to understand it is not a matter of if my mental health will be affected by this crisis. It's about when and how.
The website is new, and Indiana Family and Social Services staff are looking for feedback. If you want to check out the website, it's called BeWellIndiana.com. I'm Melissa Donovan, RTV6.
And your first look at weather on this chilly spring day. Feels more like fall, doesn't it? The cool temperatures stick around, but not for long. Temperatures overnight will be in the 40s. We'll make quick progress during the day tomorrow. Temperatures starting to jump back into the 60s. Wait till you see the weekend warmth. 46 in Crawfordsville and Muncie. Temperature in Richmond, Wayne County, only 42. That'll make you chuckle. Temperatures tonight stuck in the 40s. We'll talk about that big warm up for the weekend coming up.
Hundreds of complaints filed against the former owners of Indiana Beach. Coming up, what happens now that the amusement park has new ownership? Call 6 investigates.
Plus, a new effort to help frontline workers rebound from the COVID-19 pandemic by tackling their debt. The organization behind the initiative and how the process works.
Case of Homes every Sunday morning at 11:30. This is RTV6 News at 7, working for you.
Call 6 Investigates is looking into what new ownership of Indiana Beach means for hundreds of people who have filed complaints with the Indiana Attorney Generals against the amusement park's previous owners. Many Indiana consumers bought 2020 season passes only to learn in February that Apex Parks Group planned to close it. Lisa Story of Buffalo, Indiana reached out to Call 6 Investigates with concerns. We started digging and found more than 200 complaints filed with the Indiana Attorney General's office against Apex Parks regarding refunds for passes and campsites.
We've asked Apex twice through emails about getting a refund, and we've received nothing. So we contacted the Attorney Generals, and then we contacted you guys for help.
On April 23rd, White County officials announced Indiana Beach has a new owner, Chicago businessman Gene Staples. Call 6 Investigates did some checking and found the new owner will honor 2020 season passes. That means Lisa and hundreds of other park goers won't need refunds after all. Their complaints remain open with the Attorney General's office, who will work to resolve their concerns with Apex. Apex did not return our request for an interview. United Airlines is making it easier to change or cancel even more flights, but ticket holders will have to act fast to take advantage of it. Passengers can now cancel or reschedule flights they have booked through the end of this year. United will waive any change fees and give passengers 24 months to use any vouchers, but they must make the changes by the end of May. United is planning to operate just 10% of its scheduled flights for May and June.
1 in 5 Americans has at least one medical debt in collection on their credit report. Economists predict the numbers could get worse due to the COVID-19 pandemic. Scripps reporter Chloe Norquist explains how a nonprofit group could help people rebound from the crisis by erasing that debt.
We buy that debt and wipe it out.
Craig Antico is the co-founder of RIP Medical Debt, a nonprofit that buys up bills and wipes them out for people.
We've abolished over $1.5 billion of debt for over 700,000 people.
Recently, the organization started the Helping COVID Heroes Fund to help frontline workers get rid of pre-existing medical debt.
We now found between $70 and $100 million of debt of those people that we can abolish debt for.
Here's how the process works. Say you have a past due medical bill sent to a collection agency. If left unpaid for a certain amount of time, it could then get sent to an attorney, impact your credit score, or for those who can't afford to pay it, sink them deeper into a financial hole.
They just can't pay anymore.
That's where RIP Medical Debt steps in.
So the hospitals have to take a discount. Otherwise, they'll get nothing. So that's why they work with us, because they'd rather get something than nothing.
More than 1 in 3 Americans struggle to afford the cost of their medical care. Nearly 1 in 6 has been contacted by a debt collector over a health care bill.
There are just lots and lots of occasions where individuals have gone bankrupt because of medical costs.
Matt Klaus has been a finance professor for over 40 years. How big of a problem is medical debt in the U.S.?
It's a huge problem. Just the medical costs have been going up so quickly. And in some cases, some people who are covered, if you've got an insurance program that covers you, oftentimes you don't see the bill to see what kind of costs there are.
And as America faces the financial impact of the COVID-19 pandemic, Max says things could become worse.
What's scary now is people are losing their jobs. They don't know whether they're going to be losing coverage or not. People have been furloughed but have been told that they will still have medical benefits. But if you're just plain unemployed and you have no medical benefits, that's what becomes scary, because now if you do get sick and you get put in the hospital, who's going to pay for that?
Craig says there are some ways to avoid steep medical debt, like letting collectors know the financial position you're in, understanding your medical coverage, and just being aware. RIP Medical Debt also takes donations through their website to help those in need.
This is one of the things that you can actually do and know that the dollar is going to abolish $100. The group that I buy from debt buyers is already filtered and made sure that the people actually qualified for the debt abolishment. People are one illness or accident away from financial ruin in this country, and maybe we can help the ones that are being harmed the most.
I'm Chloe Nordquist reporting.
Coming up, possibly more proof that vaping, although popular, is really not a safer option than regular smoking. We have the results with a new study.
If you're looking for warmth, there it is. Phoenix at 99, 81 in Denver, 73 in Kansas City. And you say, great, when's it going to warm up here? The answer coming up.
IanWindows.com today.
Welcome back. A new study is adding more fuel to the fire that vaping is just as dangerous as smoking traditional cigarettes. Researchers at Boston University studied a group of 400 people. Some smoked cigarettes, some vaped tobacco, and some didn't smoke at all. They found vaping and smoking had very similar effects on the arteries and blood vessels. The researchers say many smokers switch to e-cigarettes because they think they are healthier, but there are a growing number of studies that show little to no difference.
New unemployment numbers are out, and they show a decline in the number of Americans applying for unemployment benefits. Alicia Nieves reports.
With at least 6 weeks of most businesses shut down, unemployment claims spiked to historic highs. But now, the U.S. is starting to see a downward trend over the past 3 weeks, with the latest report showing last week there were 3.84 million jobless claims, about 500,000 less than the week before. And these numbers are expected to continue going down.
If you start working again, but you're only coming back to part of your hours, you may still qualify for unemployment insurance as a partial unemployment insurance benefit.
Michelle Evermore is with the National Employment Law Project and has answers to 3 common concerns some may have as they get off unemployment and get back to work. Like, if you feel it's unsafe to return to work, can you refuse and stay on unemployment?
Workers can't refuse suitable work if it's offered to them, but I think in some cases, the work that they're being offered isn't really suitable if it's not safe.
For now, you can only refuse to go back to work and maintain unemployment benefits only under these circumstances.
If they're sick with COVID-19, caring for someone with COVID-19, they have lingering COVID-19 related disabilities, or they have caregiving responsibilities related to the virus.
The next fear some have is if there's another spike in COVID-19 cases. What happens if there are closures again and you get laid off a second time? Do you have to start a new claim all over again?
It's not so much that a worker would have to start a brand new claim. They could continue the old claim. And the good thing is now the agency has verified their income and where they've worked. And so all the agency would have to verify is that they indeed did lose work again.
Millions of Americans who have applied for unemployment over the past few weeks are still struggling to receive that money. In Florida alone, only 35% of their roughly 2 million unemployment claims have been processed, and only 20% have been paid. So what if you're someone who's been waiting for weeks for benefits but are returning to work now? Can your claim still process, and will you get the money for the weeks you were not working?
Workers should absolutely qualify for unemployment for the weeks that they were unemployed, and that should apply retroactively.
If your claim is denied for some reason, you can appeal it.
Fight for your unemployment insurance rights.
I'm Alicia Nieves reporting.
We can sum up the temperature trend in one word: warmer. Warmer days ahead, and that includes the all-important first weekend in the month of May, as temperatures will jump well into the 70s. Quite a change from the 40s that we have now. Bet you wore a winter coat if you were out very long today. The spiral of clouds and showers slowly pushing to the east. It takes with it the colder temperatures. There's been a cool pool of air. You see what happens when you get back into central Illinois and areas west. Skies clear. They've had some late-day sunshine. Dry tomorrow and Saturday. Our rain chances overnight into Sunday increase. Sunday's the next most likely day for rain and some thunderstorms. That northwest wind will begin to calm down. You can see it's already let up in the western portion of the state. Winds are still 10 to 20 miles per hour out of the northwest in Indy. 42 in Richmond, 53 in Terre Haute. Notice the edge of the clouds to the west thinning out, and that's why temperatures are warming up. And we'll also see a change in the wind direction as we move forward. 66 tomorrow. It will feel so much different with some sunshine, with the wind not nearly as strong as what we had today. Temperatures push to average for this time of year, and of course we step into the month of May. Almost to 70 in Terre Haute and Bloomington. As far as where we're headed over the weekend, temperature Saturday 74. If you have to do outdoor work, getting other stuff done on Saturday, better choice than Sunday because of the rain potential Sunday. It looks like we'll have a round of showers and thunderstorms in the morning, and then the threat kind of moves south. Saturday wind picks up, and that's key though. Out of the south, 20 miles per hour, bringing in the warmer temperatures. 74 in Indy. That's a conservative high. We could be a little warmer than that, like Bloomington and Columbus. Saturday night into Sunday morning, you'll see the rain show up. There are the rain and thunderstorms first thing Sunday morning. As we take it to mid-morning, it's starting to slide a little more to the south. Temperatures going the other way next week. We're cooling back down. As you look at the 7-day forecast and we put it all together for you, temperatures that peak over the weekend then hit the valley on Wednesday. 60 degrees for the high temperature, back below average. Well, we've been all over the place as far as the temperatures and precip within the last month. Kyle Mounts has a look at the May outlook.
Spring is well underway, and things usually really start to heat up here in the month of May. But before we look at what the new month has in store, a quick look back at that bumpy temperature ride in the month of April.
Of the 30 days in the month, more than half featured highs below average. Our warmest days actually came early in the month, with highs pushing 80 on a couple of occasions. That actually ties in nicely with our May outlook. Yes, we are expecting below average temperatures to win the month, but we're at least expecting things to start off warm. We have a couple of 70s coming our way for the first full week of May.
You might need those jackets by the middle of the month, though, as we trend back below average. Good news is our average high gets to 70 by May 5th.
April came in about 2 inches shy in the rain department, and May might not fare much better. The outlook calls for below average precipitation across parts of the state, so you may want to have those lawn sprinklers on standby. Working for you, Kyle Mounts, RTV6.
Sticking together while staying apart.
Disney is introducing non-medical face masks featuring some of its most popular characters. The characters include Mickey and Minnie Mouse, Anna and Elsa, Woody and Buzz Lightyear, the Avengers, R2-D2, and the Mandalorian character people call Baby Yoda. They cost $19.99 for a 4-pack and are available for pre-sale at shopdisney.com for estimated shipping in June. They come in small, medium, and large. Disney is donating all profits from the U.S. sales of the masks up to $1 million to the nonprofit group MedShare until September 30th. Disney is also donating 1 million of the masks for kids and families in underserved and vulnerable communities across the United States. They will be distributed by MedShare.
Well, desperate times call for desperate measures. A town in Sweden has a rather unique solution to keep people out of a local park. Each April 30th, thousands gather for special evening picnics and bonfires. Now, right now, Sweden's social distancing guidelines prohibit gatherings of more than 50 people. So the town of Lund, they decided to spread a ton of chicken manure all over the lawn to discourage any parties. They say it's a win-win situation, a solution for them. People will stay away and the grass will be in great shape for the summer. You gotta do what you gotta do.
Let me clear the air here, Mark. Temperatures, they'll be in the 70s over the weekend. You can wear shorts again. You can find a short sleeve shirt. I think you'll love it. That's what we've got to look forward to.
I love having something to look forward to like that, Kevin. Thanks for making RTV6 your choice for news. We'll see you at 11.